This segment of Showcase is brought to you by the Center for Physical Therapy and Sports Medicine. And Caroline, what are we doing today? We're going to be learning about concussions, right?
Yes, we are going to be learning about how physical therapy can help in concussion rehab.
Okay, well, I'll tell you that I'm the mom of 2 athletes, and concussion talk is such a big deal because we know it's important. We know we need to watch out for it. Also, they give parents no information about how we're supposed to know if your kid has a concussion, once they have one, what you're supposed to do. So you're going to kind of walk us through all the information we need.
Yes.
Okay.
Yes, I would say, anytime there's a head injury or even a whiplash injury, it doesn't have to be a big head impact. Mm-hmm. Concussion can look different in everybody, so we're looking for headache, dizziness, mood changes. Like if you just feel your kid is not acting right, it's probably worth getting checked out.
Now, how long is that time period? Is that usually an immediate thing, or can it be a little bit after that we would be looking for those symptoms?
We look for those symptoms at impact. Usually we take them out of the game. There should be, somebody on the sidelines who evaluates that. Yeah.
Okay, so you've got some tests so that you can find out if we're affected. What are we going to do?
When somebody comes to physical therapy, they've had a head injury, think they have a concussion, we can address a bunch of different aspects of it in therapy. So a lot of times the neck is affected. We can work with different things to treat the neck. We can work on the vision and the vestibular or the balance system.
Okay.
So we do all sorts of aspects of it. And then as we work towards getting back into sports, we try to incorporate multitasking and things like that are often difficult when you've had a head injury.
For some of us, it's difficult even when you don't have a head injury. All right, so you're going to show us what this machine is for.
So we're going to come over here.
Okay.
And with this one, we're going to kind of incorporate some of the balance, some of the visual aspects, and some multitasking.
Okay.
So
I am terrible at all of these. So let's see how this goes, Caroline.
All right. You're going to stand in front of these lights here on one leg. They're going to light up one at a time, and you're going to, as quickly as you can,
try to hit
turn
them
off the light by hitting them.
Okay.
All right, ready? Go.
How am I doing so far?
Nice.
Okay.
Very good. And we can look at your reaction time afterwards and compare it to maybe how you did before or at the beginning of rehab to the end of it.
Now, what ages do you treat for this?
We treat any age. So, of course, we see a lot of those soccer, football players with concussion.
Right.
But we also see lots of concussions from things like falls, car accidents. So that can affect really the whole lifespan. So that's an aspect that we may not always think about when we hear the big headline concussion.
Right.
But
that's true, because you always want to think sports. Well, I always want to think sports first,
right.
But you're saying so many other ways that this could happen.
Yes, car accidents, falls, that type.
Tell me about some of the technology that you guys use here, because I know you have very specialized instruments to be able to help as well.
Yeah, so we've got things like the blaze pods, which you just saw. If we're working on treating the neck, we have some fun activities that we can incorporate, like the head laser.
What is that?
So we work on some proprioception. This would go on your head.
Okay.
And then we can trace through a maze or do activities
no
like that.
No pun intended. Well, this is very cool, and I love that you're teaching us that there's so many different things to look out for sure. You want to be extra safe to making sure that if someone maybe even the slightest chance of having a concussion, that they come in and they get checked out and work with you, because you guys are the experts.
Yes.
Yes, I love this. Well, if you want to find out more, the Center for Physical Therapy and Sports Medicine is here to be able to help you. You can meet Caroline or anyone on the staff and learn more about concussions, learn more about what they can do to help rehabilitate you, and just any general information you might have as well. So thank you for teaching us so much.
Thank you.
How did I do, by the way? Did I pass the test?
Oh, yeah.
Okay.
Flying colors.
Thank you. This segment of Showcase is brought to you by the Center for Physical Therapy and Sports Medicine.